Hello guys, welcome back, and today we are going to discuss about another topic, that is communication or effective communication and the role of communication in patient care. And also we are going to discuss what is therapeutic communication or what is the meaning of therapeutic communication. So what is communication? We all know that the meaning of communication because we are doing it every moment, right? So communication is the process of conveying message. So don't confuse that we can communicate only through the words, only through the voice. We can communicate either verbally or non-verbally. So communication is the process. It is a process of conveying message, or it is a process of making the person to understand something. We can use verbs, we can use non-verbal kind of gestures also, but it has to communicate. That's it. So what is effective communication? From the word itself, meaning is there. It is a process of exchanging ideas, thoughts, opinion, knowledge and data in order to ensure that the message is understood and received with clarity and purpose. So if you read clearly, you will get the meaning. Exactly. It is a process of exchanging ideas. So what is happening in communication? We are exchanging idea. For example, in this communication, through this platform, I am trying to exchange some ideas and my thoughts and my opinion and my knowledge which is related to health and social care or nursing or health and data in order to ensure that the messages, that means this communication is understood. It means who understood? The person who listened me. Okay, understood and received with clarity and purpose. So if you receive it in a proper way, definitely after listening my videos, I'll get the messages. I'm getting sometimes the messages. It is good or it is need to be more clear. So after receiving, if I'm getting a reply back, means what? The message is reached or it is received by the receiver with clarity and purpose. So effective communication is the process of exchanging ideas, thoughts, opinions, knowledge and data in order to ensure that the message is understood and received with clarity and purpose. So that two things are very important, guys: clarity and purpose. Then, effective communication makes both sender and recipient become happy. That is the end result of effective communication. Okay, so that is the end result. So, if your communication is clear or effective, what could be the end result? You feel happy, even I feel happy. So, if we both are happy, that means the communication is effective or the communication was effective. And there are various ways to communicate. As I said, don't think that only through the words only we can communicate or only through the voice only we can communicate. No, we can communicate both verbally or non-verbally. Verbally means what? We will use the verbs like what I'm talking right now. I'm using voice, sound. Okay, non-verbally also I'm communicating right now. How? I'm giving the slides to you to read. So here you are doing both. We are doing both verbal and non-verbal communication. So there are various ways to communicate, such as through writing, listening, visual or non-verbal. That means verbal and non-verbal communication. Alright guys. Then now we will see the 5 C's of communication. So there are some specific characteristic features which you have to possess while doing communication. Then only you can make your communication become effective. So these are all that 5 C's: clear, correct, complete, concise and compassionate. So you have to focus these 5 C's while doing communication to make your communication become more effective. First one is clear. Your communication will be clear. It has to be clear. You have to think whether I am passing or whether I am conveying something which is clear to me and which will be clear for them. Okay, then correct. You have to convey the correct message. Don't pass the wrong message. If you don't know, make it correct and you can send the message or you can communicate with the person who is listening. Then complete. You have to send the complete message. Incomplete message will reduce the clarity. Then concise. It has to be short and brief. Then compassionate. So while doing the communication, you must think about your listener. What is their listening capacity or what is their understanding capacity. If they can easily understand, you can do it in a very a quick way. If they need some time to understand, take your time and you need to show some patience while talking. especially in the healthcare setup, you have to show that patience towards your patient. Then only the communication become more effective. But however, these features sometimes may vary depending on who you are asking. So clear, correct, complete, concise are the what 5 C's of communication. But these all what features will not be will not be useful or will not be effective in all type of communication. So these 5 C's will get vary depend upon the person to whom you are communicating. But you have to keep this point in your mind while doing communication. Clear, correct, complete, concise, compassionate. These are all the 5 C's. Then now we will see what is therapeutic communication, because we are talking about effective communication and how effective communication can improve patient care, right? So of course we need to talk about therapeutic communication. So therapeutic communication, the word itself meaning is there, therapeutic. Therapy is nothing but treatment, right? So therapeutic communication means during the time of treatment, during the time of giving care to the patient, if you are maintaining up communication, means that is called therapeutic communication. So therapeutic communication will be the communication which you are using, or it is a communication which you are using while giving treatment or while giving care or while giving service to your service user or patient or client. I'll give you a simple example. If you read this example, easily you will understand what is therapeutic communication. Still you have any doubt means, Mr. John, you look dull and tired, or I haven't seen you eating anything today. So this is therapeutic communication. Okay, so you are working, okay, in a hospital or in a care home or in any healthcare setup, and after seeing your patient or after observing your patient, okay, you are talking to your patient. Okay, after observing your patient, you are asking the patient like, Mr. John, you look tired and dull, or I haven't seen you eating anything today. So here what you're doing, so you are sharing an empathy with your patient, right? So getting into the shoes of the patient, after seeing the patient, after observing the patient, you understand that what the patient is very dull, look dull and tired, so I haven't seen you eating anything today. So this is therapeutic communication. So here what you are doing, you are showing sympathy, at the same time you are sharing empathy. Okay, so what is empathy? The ability to understand and accept another person's or your patient's reality and providing support. So that is called therapeutic communication. So in therapeutic communication, what is happening means a treatment based communication is happening there. Okay, that is a simple meaning of therapeutic communication, treatment based communication. So after seeing a patient, Mr. John, you look very dull, you are tired, and then you will get a reply. So automatically you will get a chance to open a communication, and after opening the communication, you have to show empathy. Okay, so you have to get into the shoes of the patient, okay, and understand what he or she is undergoing and find out the solution. Then this therapeutic communication will be effective communication. And sharing silence, that is another example for therapeutic communication. So what is the importance of silence like that? We will think, okay, in communication means we need to communicate, but what's the importance of silence? Silence also a technique of effective communication or therapeutic communication. That means what? Give some time for the patient to open up. So you are keep on talking, okay, without a gap. If you keep on talking, you are suggesting, demanding, judging, okay, giving orders one by one, do that, do this, followed by this, followed by that, you have to do that, you have to do this, if you are not doing this will happen. Like if you keep on dumping the ideas and informations on the patients, what will happen? The patient will get irritated. So sharing silence also a technique which you can use in therapeutic communication, or to make the communication become effective. And during that silence time, what will happen? We are giving some time to the patient to open up. So the patient will come to a comfortable stage, and the patient will start to open up, and you can start find a solution for their problem. So what is therapeutic communication, guys? It is a treatment based communication. So during the time of treatment, during the time of care, if you are maintaining a communication with your patient, By sharing empathy, by sharing silence, by sharing sympathy, by showing empathy, by showing sympathy, or by showing silence, and by showing respect. Okay, that is known as therapeutic communication. Then, uh, while coming to the concept of therapeutic communication, I just want to tell you once again that you have to put your patient first. If you are keeping or putting your patient in the center of care and always give first position to your patient, means that will be very effective, and that can improve the effectiveness of communication. Then active listening. So in therapeutic communication, always you have to be a good listener or you need to be a good listener rather than a speaker. Then talk with the empathy. You know the meaning of empathy. Okay, empathy means get into the shoes of the patients and think, okay, what they are undergoing. If you follow these concepts, definitely you can make an effective therapeutic communication, or you can develop an effective therapeutic communication with your patient. So therapeutic communication is a type of professional communication between healthcare professional and the patient. It must be purposeful, interpersonal, and informative. So in therapeutic communication, you have to maintain a professionalism, because you're not talking to your family or friend or whoever. Okay, you are going to talk to your patient. So it is a type of professional communication, so you have to maintain that professionalism. You should understand your personal and professional boundaries while talking to your patient. That's very, very important. At the same time, it must be purposeful. It must be purposeful. It must be interpersonal, in between you and your patient, and informative. So these are all the concepts which you have to keep in your mind while doing therapeutic communication with your patient. Always put patient first, active listening, talk with empathy, and the communication must be purposeful, interpersonal, and informative. So in conclusion, we can say therapeutic communication is a type of professional communication between healthcare professional and patient. According to the research, or according to one study in United States and United Kingdom, with at least 100,000 employees lost 62.4 million per year due to poor communication. So, if you are, it shows what? If you are not communicating properly, you will lose everything. Okay, the same thing you can implement in your healthcare workplace also. If you're not communicating properly with your patient, the patient will not give a proper feedback, and the patient will not get any improvement in their health or condition, and at the same time you cannot give quality care to your patient. That will affect both you and your patient. That will affect the quality of care which the patient is supposed to get, and at the same time that will affect your career, your profession. So always keep the point in your mind that your communication need to be clear. It must be with a purpose. It should be with a proper understanding. Okay, so you have to keep that point in your mind while doing communication with your patient, or while conveying some messages to your patient. Then how effective communication is beneficial. So what is the benefits of effective communication? So we have discussed right now. So far we had a discussion regarding this only, but again I just want to specifically mention it can help you to manage the relationship with patient and build teams, grow professionally and personally. It improve creativity and innovation in care. It will help to build strong relationships. It improves social, emotional, and mental health of your patient as well as yours. It improves your problem solving skills. So these are all the major benefits of effective communication. And what kind of techniques you can use to make your communication become effective, or the techniques of effective communication? First and foremost thing is respect your patient. Give respect and take respect. To show respect, you need to be humble. So give respect to your patient. Okay, first try to respect your patient, not try to, you have to respect your patient. So if you give respect, definitely you will get respect back, and you can make your communication become smooth. Then be attentive. When the patient says something, you need to be attentive. Don't turn your head here and there. Don't turn back. Okay, some healthcare professionals will do that. The patient will keep on talk, and the healthcare professional will be in computer or will be somewhere. Yeah, yes, 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 like that will, and that will lose the confidence of your patient, and they will not open up in a proper way, and you will not find out the actual problem of the patient. Then rapport. Rapport means what? It is nothing but introduction. So start your communication with a good introduction. That's very, very important. A warm greeting. You have to greet your patient. You have to give confidence from the starting. Hey John, how are you? How are you doing? All good? Okay. How was your day today? Okay. Like that. You have to do a good confident starting. Then only the patient will feel some confidence to respond back. Okay, then listener. As I said, you need to be a good listener rather than a speaker. Listen your patient. Listen what the patient what they want to tell you. Okay, sometimes it takes time because they are under or they are undergoing lot of pain, suffering, traumas. So what you have to do, you have to give time and listen what they are telling. Sometimes it takes 1 or 2 or 3 days or 1 week to explain their problem. Just give time. Okay, always give some confidence to them and just tell them that take your time. Then automatically they will open up, they will explore everything, they will open the windows of their mind and they will explain everything to you. These are all the things, this happened. Then you will find, then you can find out the actual cause or the root cause behind the problem. Then humor, you have to use some humor also. It doesn't mean that you have to laugh and you have to use funny things meanwhile or during the time of procedures and all, but you can use some kind of humor with your common sense, okay, to make the situation become a bit light. Okay, then non-judgment. Don't judge your patient, please don't judge your patient. That is very, very important. So that is the main challenge which is faced by the healthcare professionals in the health and social care setting. Okay, don't judge your patient. If you judge your patient, definitely that communication will get break. The communication will get break and the communication will not be effective. So don't judge your patient. Open-ended questions, that's very important. Use open-ended question. Don't close your question. What's your name? Can I know your name? What's the meaning of your name? Okay, I think this could be the end result of this. What do you think? So give open-ended questions to make the patient to talk. If you close the question, everything will get closed. If you close the window, no one can enter into the house, right? Or if you close the window, the breeze or the wind will not come inside the room. So in rather that if you open it bit, it will come, it will give some some relaxation. So same way, if you do an open-ended, if you're asking open-ended questions like I think that could be the best solution to solve this problem. Would you think like could you do you have any idea about that? What do you think? So they will start, yes, I think that. Then from there you will get next question. Again, next question. So till you get the answer, till you get the actual reason behind their problem, you can extend the communication. Then plain simple language, that's also very important. Which language the patient is talking, try to talk in that language, that is actually good. But which language in that word in that area, which language is using, you have to use that language in a plain and simple way. Don't use jargons and different kind of words and stuff. If you use, they'll sometimes not understand what you're talking. So simply plain simple language you need to use to make your communication become more effective. Then confidentiality, you know the importance of confidentiality, especially when you are working in a healthcare setting. You have to maintain confidentiality because the patient is you are making the patient to open the window of their mind and they are revealing everything about them. So you have to maintain a confidentiality. You have to give that assurance to your patient that okay, don't worry, everything will be safe, everything will be safe and secure in the reports. Okay, you don't worry about anything, it will not go out, it will not disclose. Okay, so you have to give that confidence to your patient. Now, principles of effective communication. Okay, so now we will see the principles which have to hold or possess while doing communication to make the communication become effective. Make a good impression by introducing yourself. As I said, rapport. Building trust through active listening. You need to be a good listener rather than a speaker. Ask open-ended questions, and sometimes you need to ask closed-ended question also. That is depend upon the situation. Make the appropriate tone. Okay, you don't not to be too loud or less voice. You have to maintain the pitch volume of your voice. Consider the patient's viewpoint or think about the patient's perspective. Recognize bias. If you are talking something wrong or incomplete, understand that. Communicate in variety of ways. Use verbal or non-verbal depend upon the situation of the patient. Recap everything, especially at the end. Like so far we had a discussion, like every at the end of the video sometime we will do same way. Recap everything. Then final words. Draft a contract and put it in writing. It is nothing but just write down everything and keep it in a record, or that's called process recording, right? So record everything and it will be useful for the next person to continue the care. Then ask both closed-end and open-ended questions. I told you ask open-ended questions only or follow open-ended question, but sometimes you have to use closed-ended questions also depend upon the situation of the patient. Always begin with open-ended questions because the patients often share what's on their mind. Once this is addressed, they will be more relaxed and open to closed-ended questions. Okay, good open-ended questions are: what is the problem today and how can I help you? Next comes, when did the problem start? So you can connect and talk. Okay, then after which ask, have you seen anything else related to it? Okay, then you can give some time and everything. Then, have you ever drank alcohol on regular basis? So in that way you can use both open-ended and closed-ended, but try to start your communication with open-ended questions. That's very, very important. So according to the Nursing and Midwifery Council, a nurse must be able to speak clearly, use language that patients, co-workers and the general public can understand, adapt to people's language and communications needs by helping those who need it, use a variety of communication techniques, confirm people's understanding to prevent misunderstanding and speak fluently. Okay, so how a nurse or midwife or how a healthcare professional need to behave means, if you read these slides you will understand. According to Nursing Midwifery Council, a nurse must be able to speak clearly and use language that patients or co-workers or the general public can understand. Adapt people's language and communication needs by helping those who need it, and use a variety of communication techniques, that means verbal and non-verbal, and confirm people's understanding to prevent misunderstanding and also try to speak fluently. Then patient perspective, that's also very, very important. You have to think about the patient perspective. So to get into the person perspectives, what you need means you need empathy and sympathy. What is empathy? Get into the shoes of the patient and understand what the patient's actual situation. That is called empathy. Sympathy means like showing some kindness towards the patient. Okay, so you should show these two characteristic features, or you need to possess these two basic qualities to understand the patient perspective, also to make the communication become effective. Different forms and styles of communication can be used in healthcare and social care setting based on the following factors. So as I said, there are different type of communications are there: verbal communication and non-verbal communication. Different form and styles of communication can be used in healthcare and social care setting based on following factors. The patient status, that's very important. The patient can listen and understand you well and good, you can use verbal communication. The patient is not in a stage to understand. The patient is having some learning disabilities. The patient is having some verbal disability. The person is having some hearing disability. In that case, you can use non-verbal communication. So understand the patient's status. Here I've given an example: a child versus an elderly person. That's a simple example. To child, how you will communicate; to an elderly person, how you will communicate. Communication style will be different, right? So you should understand what type of patient you have. in terms of age, in terms of their condition, in terms of their ability to understand. That you have to understand first. Then the information being communicated. Okay, so details about the medication dosage, how you will communicate that thing to your patient. You have to communicate in a clear and precise way. So you have to take this twice a day, you have to take thrice a day. You, if you, instead of that, if you're saying like 2D 3D, OD means something they don't understand. You have to, you can write OD once a day, but you have to specifically say, okay, once in a day, thrice in a day, twice in a day. And delivery schedules and modification to the current regimen versus details about daily menu in the healthcare and social care facilities. So what kind of information you are communicating, based on that also you have to change the style and form of your communication. Then effective communication in healthcare and social care setting requires accuracy, consistency, transparency, accessibility, inclusivity, regardless of the format or style. So these things you have to keep it in your mind while doing communication to make the communication become effective. It must, along with that 5 C's, okay, accuracy, consistency, transparency, accessibility, inclusivity, and regardless of the format or style, you have to maintain accuracy, consistency, transparency, accessibility, and inclusivity, along with 5 C's: clear, complete, concise, compassionate, and complete. Then, as I said, there are different types of communication. Basically, we have two types of communication: verbal and non-verbal communication. What is verbal? Verbal means we are using words. Non-verbal means we will use postures, gestures, cards, images. We can use either verbal or non-verbal communication depend upon the situation of the client. That is very important. You should understand who is your patient, what is their condition, what type of communication become effective for this so and so patient. That you should understand, and then you can implement either verbal or verbal communication. Then person-centered care and effective communication. What is the meaning of person-centered care? Person-centered. So putting the patient in the center of care and providing care means that is person-centered care. Effective communication will help to establish a shared understanding of the issue, the objective of the treatment, the obstacles to the treatment, and wellness required. So in person-centered care, effective communication will be effective, okay, to establish understanding, to understand the objective of the treatment, to understand the obstacles of the treatment, and also understand the wellness which require. So which means what? Which means recognizing the patients as whole and including their personality, life history, and social structure. So person-centered care and effective communication, how you can what collaborate means, first you understand what is person-centered care, putting the patient in the center of care, that is called person-centered care. To provide person-centered care, we have to possess effective communication. You should understand their life history, social structure, and personality. To understand their personality, life history, and social structure, what you have to do, you have to communicate with your patient. So to communicate with your patient, you have to use the techniques of communication. If you use the techniques, effective communication technique, you can make the communication become more effective, and you can collect all the information, and you can give actual person-centered care to your. So according to the Nursing and Midwifery Council, a nurse must be able to speak clearly, use language that patients, co-workers, and the general public can understand, adapt to people's language and communications needs by helping those who need it, use a variety of communication techniques, confirm people's understanding to prevent misunderstanding, and speak fluently. Okay, so how a nurse or midwife or how a healthcare professional need to behave means, if you read these slides, you will understand. According to Nursing Midwifery Council, a nurse must be able to speak clearly and use language that patients or co-workers or the general public can understand, adapt people's language and communication needs by helping those who need it, and use a variety of communication techniques, that means verbal and non-verbal, and confirm people's understanding to prevent misunderstanding, and also try to speak fluently. Then also, I just want to say that WHO principles of communication. WHO means World Health Organization. It should be accessible to the decision makers, actionable by decision makers, credible and trusted as perceived by decision makers, relevant to the decision makers, timely to enable decision making, understandable to the decision makers. So these are all the WHO principles of communication that we will discuss detail in another video. Hope you understand what is communication, what is effective communication, techniques of effective communication, what is therapeutic communication, how we can provide effective communication in person-centered care. Thank you guys. We will we will come with another video. I'll come with another video. Okay, next. Thank you for listening.